Welcome to another easy nursing review. In this lesson, we will cover hyperglycemic hyperosmolar state. But before we begin, let's see if you can get this answer correct. In the intensive care unit, the patient with type 2 diabetes is placed in a hyperglycemic hyperosmolar condition coma. Which evaluation results would the nurse anticipate seeing from the patient? 1. Kussmaul's respirations. 2. Diarrhea and epigastric pain. 3. Dry mucous membranes. 4. Ketone breath odor. Comment what you think the answer is in the comments below. Now let's begin by first learning. What is hyperglycemic hyperosmolar state? Hyperglycemia and hyperosmolarity are the main symptoms of this potentially fatal illness, which also involves changes to the sensorium. The patient's awareness will be impacted by this knowledge. This is life-threatening. Ketosis is minimal or absent. This is key because which patient has ketosis? Type 2. The basic biochemical defect is lack of effective insulin, which is also known as insulin resistance. Now, here are the signs and symptoms of the patient. The patient will present the following. Extreme hyperglycemia occurring without ketosis. This condition occurs most frequently in clients with type 2 diabetes. It will occur slowly over a period of days. Key to remember is that this is gradual. There may be a history of days to weeks of polyuria with adequate fluid intake. The patient may also exhibit hypotension and tachycardia. Severe dehydration is often resulting in hypotension and compensatory tachycardia. This is a key sign. Additionally, there may be a change in mental status, neurological manifestations, coma, and even death if not corrected. Now let's go over important labs as they will reflect the following. Hyperglycemia, which is manifested in blood glucose levels ranging from 600 to 1200. Okay, let's move on and learn about treatments for hyperglycemic hyperosmolar state. The overall treatment of this medical emergency is similar to that of diabetic ketoacidosis, which involves fluids, electrolytes, and insulin. Start with fluid replacement. Fluid replacement is given with normal saline and then dextrose solution levels once glucose levels reach 250 to 300. Intravenous insulin is given to treat hyperglycemia. It's important to monitor electrolyte status and provide replacement as indicated. Additionally, monitor mental and neurologic status and keep an eye on vital signs. Again, rehydration is key in both ketoacidosis and hyperglycemic hyperosmolar state. Alright, well, you made it to the end of the video. Back to that question at the very beginning of the video. In the intensive care unit, the patient with type 2 diabetes is placed in a hyperglycemic hyperosmolar condition coma. Which evaluation results would the nurse anticipate seeing from the patient? 1. Kussmaul's respirations. 2. Diarrhea and epigastric pain. 3. Dry mucous membranes. 4. Ketone breath odor. And the correct answer is 3. Both diabetic ketoacidosis and hyperglycemic hyperosmolar condition are associated with dry mucous membranes, which are caused by hyperglycemia. Did you get it correct? If you got it right, awesome. If not, that's okay. Just keep studying. Well, that ends this lesson. Click here for another nursing video.